Do you want to get to the root cause of your PCOS fertility struggles? Are you tired of getting dismissive fertility information from your doctor? And do you see pregnancy in your future, but honestly, you're a little nervous if it happened right now? Because with your irregular cycles, you're concerned about miscarriage. Do you want to be your healthiest as you move towards getting pregnant so you can have a healthy pregnancy and a healthy baby? Well, if that's you, then this podcast is exactly for you. Hi, I'm your host, Dr. Angela Potter. I'm an integrative PCOS fertility doctor, and my expertise is just that, helping you get to the root cause of your fertility struggles and creating a holistic plan that allows you to feel the healthiest that you can be to set you up for optimal fertility. If you are a new listener, welcome. I am overjoyed to have you here in this community. And I also want to acknowledge you for showing up here because there are so many podcast episodes out there that you are choosing to listen to this one, which shows so much about your dedication to turning around your PCOS, turning around your fertility so that you have the best chance at getting pregnant with PCOS. And I think it is so cool that you've showed up here today. Be sure to subscribe here so that you stay updated on all the new episodes that come your way, because if you're committed to getting to the root cause of your fertility struggles, these episodes are going to be key for your momentum. So right now we are in the Christmas holidays. Me and my family, we celebrate Christmas. And so new episodes are going to come out in January, but I have some really great episodes from earlier this year that I wanted to be sure to put out again in case you missed them. So this is a perfect time to listen to it for the first time. If you already listened to it back when it first aired, this is a perfect time to re-listen to it because I have got some important information about fertility treatment plans and about sperm testing for you. Lots of cool things coming your way in the new year. Enjoy this episode that I've got for you today. Today is a very exciting episode because I have Dr. Kristen Brogaard with me to talk about the male side of things. Dr. Kristen has her PhD in molecular biology, and she co-founded Path Fertility and developed a sperm test that does an even deeper dive into understanding what is keeping the sperm from optimal fertility. This is going to be really important information for you if your partner has been told, well, your sperm analysis is fine, and yet you've had failed IUI cycles and you just haven't been able to have any positive pregnancy test. Let's dive into that conversation with Dr. Kristen Brogaard. Kristen, welcome to the PCOS Fertility Health Podcast. I am so happy to have you here.
Thank you so much, Dr. Potter. I'm so excited to be here.
Yeah, we have got a lot of juicy information to dive into today. And for the listeners out there, I just cannot wait for them to get their hands on this because it's a really important topic when it comes to fertility. And it's been forgotten for a little while or kind of pushed to the side. And you are at the forefront of all this innovation. And it's super exciting. So tell us, Kristen, what got you interested in this field and how you got into setting up these labs?
Yeah, absolutely. And thank you again for the invitation and for everything you do for the PCOS community. It's just remarkable. So I'm so excited to be talking about fertility and, like you said, a very underserved area, which is male fertility, that we need to keep talking about. So how I got into this, a little background, my background's in the sciences. So I was not in reproductive health at all. I did my doctorate and postdoctorate on technology development. So specifically in personalized medicine and epigenetics, and how do we build technology around these really cool fields to help the patient experience. Was able to start my first company out of my postdoctoral work and helped grow that company, and then had the opportunity to actually I was in Seattle at the time and had the opportunity to move out to beautiful Utah because my husband was recruited out here for a professorship. and was very serendipitously introduced to my now co-founder, Andy Olson. And in conversations with Andy, he had some friends going through fertility care. And he was explaining this to me that they had spent about $80,000 out of pocket. They had been working on achieving a pregnancy for at least 2 years. And they had received the diagnosis of unexplained infertility. And I was like, wait, what? Like, in this day and age, like, what does that even mean? And so together we started really looking into this field and found out that almost 30% of couples are getting this diagnosis, so unexplained infertility. And to me, that just means there's not the right testing out there or technology out there to figure out what's going on. It's not unexplained. It's just we haven't explained it yet. And so we really started diving in, and what was extremely apparent in this field was, and I was just like completely blown away, was the lack of innovation on the male side. So there hasn't been any considerable development in the technology on male diagnostics for fertility for the last 40 years. We're using the same thing. We're using a microscope to literally count sperm under a microscope and see how they swim. Like that's the extent of what these physicians are using, because that's the only technology out there. And it became very clear that this unexplained infertility, but also up to 30% of men were going undiagnosed. So a huge portion of men are going undiagnosed. And what that means is early on in the journey, you don't know that there's a male factor. And when you know there's a male factor, you actually change treatment plans. So when men are going undiagnosed, their partner is going through procedures that aren't going to work, and it's wasting a lot of time. It's causing dropout because of failed IUI cycles, failed timed intercourse, because people are really, it's spending a lot of time trying to get pregnant when, if there's a male factor, these early procedures aren't going to work. So these women are getting subjected to treatments that aren't going to work. And it's not until really far down in the journey, where a lot of couples have dropped out and spent a lot of money, that they're actually getting to a procedure that could work in the case of a male factor. So what we did was, looking around at the landscape of technology on the male side, we identified that the field of epigenetics, which is what my background in it is in, there was a significant amount of academic research in that field showing that sperm epigenetics, which is how a sperm's genes function, turning those genes turning on and off, it actually has a very significant relationship to fertility outcomes. And so Andy and I, 5 years ago this month, started Path Fertility, and with the mission to raise the standard of care in male reproductive health and bring these new types of technology into the space. And it's been an amazing journey. It's a very humbling field to be in, talking with patients and understanding their journeys. But now we have, after thousands and thousands of semen samples later, we have a new and better diagnostic for male subfertility, really looking at sperm function. And we've now seen that it's been really incredible in these patients' journeys, diagnosing men who are missed by the standard semen analysis and being brought really earlier on in the journey and helping guide treatment.
That is amazing. And I love knowing about you and your test, because what I see so often is these women are coming in to talk to me and they're feeling like it's their fault, that their body is broken, and thinking that, oh, because, my hormones are a little more complex than my partner's, it's got to be my fault. And of course, the male partner is committed and wanting to make changes and for their own body. But when they just get this sperm analysis done, then it's like, okay, it's this check mark to say, oh, okay, everything's fine. When in reality, it's not giving us that wide perspective into what is actually going on in the sperm and in the male body. So can you speak a little more to that, about what we're not finding in typical sperm analysis?
Yeah, absolutely. And I just want to emphasize a point that you made about the burden and the stigma that's getting placed on the female. That is a very significant part of the journey of this fertility journey, is that historically all the burden has been on the female, because her biology, because she's carrying the child and has the egg, it's been considered more complex. And so, check mark, semen analysis looks great, and she's really owning more of that burden. So a lot of our passion is bringing some equity into the process. It's not a blame game, but showing that there is more complexity on the male side, and that we need to bring some more equity into the journey to really even out that whole process, because it's been I've had that experience too. I never at once thought it could have been, my husband or my friend's male partners. You just always hold that blame going through your own journeys. But to your question, what semen analysis does, which adds a lot of value. Semen analysis is something that is here to stay, particularly if you have very low sperm counts. But what it is, it's a snapshot. It's a snapshot of how many sperm are there and how well they move in the shape of their head, and their tails. But what's interesting about semen analysis is that it changes dramatically. It can change between two semen samples within 3 days of each other. It can change within a month of each other. So there's a lot of variability within semen analysis. But if you tend to have very low sperm counts, that's what's consistent. So the variability is hard because it doesn't lead to a lot of predictive value, because it is very variable. The other thing is that it's just a visual assessment of sperm. And we know from just biology and from other diseases, what you see is not necessarily what's going on internally. You can look fantastic and healthy, but you can have a disease developing inside of you. And that's what we're seeing and what we're really diving into. Sperm QT, our test, is one way to do that, where we actually look at how those genes are turned on and off during spermatogenesis, or when the sperm mature. But it is not the end all be all. We need a lot more tests to understand, like open up the hood, look inside the sperm, seeing what's going on, to really start to understand the full complexity of male fertility. It is actually a pretty remarkable, complex journey that the sperm goes through, from start all the way to the penetration of the egg, and then the role of sperm in actually implantation and maintaining a healthy pregnancy. There's been links to sperm biology in every step of the process. So the semen analysis is fantastic, especially with low counts. The likelihood of a sperm finding an egg is lower, but we need to really start to dive into what are all the molecules inside the sperm head. How are those genes turned on and off? What are they carrying on the outside of their head that's getting delivered into the egg? There's just a lot going on that we're at the tip of the iceberg right now. I think this test is uncovering a lot, but there's a lot more to uncover. So I'm excited about the future of that as well.
Yeah, that's so great. So for somebody who's listening and wants to really delineate, okay, when do they get this test versus a regular semen analysis, which is still offering some really good information to understand sperm count and how well it's moving. But then the sperm QT test is taking that next step to look inside. What kind of markers is the test looking at, and how is that helpful for a fertility journey and determining treatment?
So in the journey, the earlier you can, the better to assess what's going on in the sperm. Because of the earlier you can understand, even when you're just thinking about trying to conceive and you don't even know it's going to be any issues, really understanding what you're working with is important. So the physicians utilizing our tests, we're integrating it with that initial diagnostic testing. So combining it with the semen analysis, but really any time, but the earlier is always better. And what we do and what we analyze, we are looking at 1,233 genes when we look at the sperm. We isolate the sperm, we understand what's going on and what genes are properly turned on and off. And what we can indicate is the likelihood of IUI success. So this is really important. And actually some new research, not by us, but other groups utilizing our test has shown that it's actually predictive of spontaneous pregnancy as well. So if you have an abnormal sperm QT result, the likelihood of achieving pregnancy is lower if you have an abnormal result in both spontaneous pregnancy, timed intercourse, and IUI. So if you have a much lower chance to achieve pregnancy in those, it's important to understand that earlier on, so you're not wasting a year of timed intercourse, stimulated timed intercourse, medicated IUIs. I mean, that can take up another year or two of time. So really finding out earlier on, and then bypassing those to get to a procedure. And right now, the procedures that we show work is an IVF with ICSI, which is intracytoplasmic sperm injection. So we know that test and that procedure overcomes any equality issues that we've identified. And that's actually the standard of care when there's a male factor. So it's bypassing all of these unnecessary treatments, saving time, and actually ultimately saving money because you're not doing all these in-between procedures. So it is really, so that's why, I mean, if you are really late in your fertility journey and you've had failed IVF cycles, this might not be the best test for you. But if you're thinking about it and you're just starting your fertility journey, like, let's figure out what's going on the male side to help direct where you need to go.
Interesting. So for somebody who's in that later journey, you're finding that it might not be as beneficial, like something else is the cause at that point.
So if there's failed ICSI cycles, so I think with ICSI cycles, we have found that our test is not predictive of those failures, sperm QT. But we do have early indication of other testing that could be indicative of an ICSI failure. So that's something we're actively developing and looking into right now. It's part of our roadmap. So we can understand maybe at which stage in the procedures we can predict lower likelihood of success. But sperm QT specifically, all the research is really directed to IUI success.
Okay, great. And I was thinking about earlier on, you were mentioning epigenetics, which for some listeners, they might not be familiar with what that means and how that ties into fertility and sperm. So can you elaborate on that and how this test is looking at epigenetics?
Absolutely. And I could talk about this for days. So I'm looking forward to this explanation and happy to answer any questions. So like I mentioned, epigenetics is the control of your genes expression. So if you were to look at every cell in your body, from your brain cells to your liver cells to sperm cells, they all have the same DNA. So it's the same DNA. It's what's really important is the software that sits on top of that hardware DNA that turns the right genes on and off. So you can imagine your brain cell has very specific genes that they need on and off in order for a brain cell to work properly. It's the exact same thing in sperm. As sperm develop, they need very, very specific genes to be on or off. That's almost as important in order for a sperm to develop properly and have all the right features and attributes in order to fertilize an egg. So epigenetics is that control. It's that software that can turn a gene on and off. And that is a really important thing to understand, like what that is for a healthy cell. But we have really good data on multiple cell types with multiple diseases that if that software, those epigenetic controls go awry, that leads to a disease. And what we have found in sperm is that if the epigenetic control doesn't look right in sperm, it's leading to subfertility in men. So the sperm isn't functioning properly in order to find, bind, and penetrate an egg. And also I want to add, this is really exciting, is that epigenetics is controlled, is influenced by the environment. So your DNA is static. Epigenetics are really influenced by the environment around you. So what you eat, how you exercise, mental health, stress levels, how you sleep, medications, all of those factors influence the epigenetic software that sits on the DNA. And a really great example of this is when you have identical twins. So in identical twins, it's the exact same DNA. When you notice and you see this in identical twins, one can actually go into a disease state while one remains healthy. And it's because the exposures those twins have put themselves under, maybe a more unhealthy diet versus a healthy diet, maybe toxin exposure versus not. So that's a great example of epigenetics at work. It's what you're exposing yourself to can change those epigenetics. And we've seen that DNA, that sperm epigenetics is actually influenced by all the same things. There's great data showing that diet, toxins, stress, sleep, age, all of that affects sperm epigenetics. So not only can we guide treatment looking at sperm epigenetics with sperm QT, we can actually, physicians are really utilizing this to help motivate for significant lifestyle changes. And we've seen patients go from an abnormal result to a normal result with significant lifestyle changes. Weight loss is a big one. Smoking is a big one. Marijuana use is a big one that we're actually seeing in alcohol use. We're seeing shifts in the sperm QT results just by lifestyle modifications. So that's a whole other area that I'm just stoked about that we can dig into to really understand, instead of just directing to a specific treatment, how can we improve epigenetics, either by therapeutics or just lifestyle modifications?
Yeah, that is so exciting. And so the hope there is that even though we're talking about DNA, it's not that this is static, that you're just born with this issue. If you've gotten a abnormal sperm analysis and oh, well, that's just me, can't do anything. No, those epigenetics, that software is actually dialing in. And because the sperm are turning over, then you can see a change moving forward.
That's a really, really great point. So something unique about sperm is that men regenerate a whole new batch of sperm every 3 months. Mm-hmm. So they're in a very unique situation to improve their sperm health compared to women. It is a continuous cycle of regeneration. So, and it's a great thing you can start to see improvements even in your sperm counts with lifestyle modifications, but we're seeing that as well in epigenetics because of that regeneration.
Yeah, that's so exciting. And so for somebody who is thinking, we need this test on board for our fertility journey, what are the logistics of getting a test like sperm QT done? Is it different than a sperm analysis? Does it require different things at a specific clinic? What are the logistics?
Yeah. So in a patient who's interested in this, who's not in a fertility clinic that orders sperm QT, they can just go to our website, pathfertility.com, and you can order a sperm QT test or a sperm QT test plus semen analysis. Either one are available. And we have a physician on our back end that will send in an order and be available for consultation upon the receipt of those results. Once the order is placed, we ship an at-home collection kit to the male partner's home. And so it's it's in discreet packaging. It's to be collected at home. So you don't have to go into the clinic for collection, which I know is a really big deterrent, which makes sense. And what it is I think you abstain from ejaculation for 2 days. You collect in a cup, you seal the cup, you put it in some prepaid shipping that we provide, and then it gets shipped via USPS in 2-day shipping. Because of the stability of the epigenetics and how the DNA is packed in the sperm head, we actually can ship at ambient temperature, which makes everything a lot simpler for the male partner in these situations. Shipping's easy and it's at-home collection.
That's so easy. Yeah, you don't have to worry about freezing it or popping it in the mail immediately. Yeah.
It's really convenient. And we have a discount code, Dr. Potter, that you'll get a 20% discount too. Anyone who listens to the podcast can get a discount on sperm QT.
Thank you, Kristen. That is amazing because I want to be talking to all my patients about this and really bring in this male side because that's really, the foundation of my work with people is we've got to get that information about what's happening and getting that clear picture. And if we don't have a clear picture of the male side, that's really 50% of this whole picture. And we don't want to let anything like this just go off without being looked at.
Yeah, absolutely. Yeah, the feedback we receive from patients, like we wish we would have gotten this before we've tried IUI 3 times and failed. This is the first piece of information that actually is explaining why we can't get pregnant. And it's heartbreaking. So we really need to bring this in and bring the male into the equation.
Yeah. And so if the male partner has had a sperm analysis recently and is thinking, well, everything's fine on that, is there any reason to hold off on doing this type of a test? Any timing between a regular sperm analysis?
No, it's just those 2 days of abstaining from ejaculation, and that's it. There's no reason to hold off on collection and analysis. It's really trying to get it as soon as possible with that semen analysis, so you have all the information quickly is really important.
And what's the turnaround time for getting the results?
Yeah, so when we receive the sample in our laboratory, it's 2 weeks from receipt to returning the data. So in those 2 weeks, we isolate the sperm. We open up the head of the sperm, which is actually very complicated.
Wow.
They're like little tanks that you got to like break open and takes quite a while to do. Extract the DNA and then sequence the epigenetic patterns on the DNA. So it's about a 2-week process. And then we deliver results to the ordering physician if they order on our site, and that information is provided back to the patients.
Okay, great. And then that's a really quick time to be able to put a plan into place and move forward to see.
Yeah.
And then would you suggest retesting after about 3 months? Because we know that's how they regenerate.
Yeah, that's exactly right. So if the patient is motivated for lifestyle modifications, especially if there's an abnormal result, absolutely. We retest, we provide discounts for that second test because we know it's the follow-up test, and that's all available online. And we would recommend to wait at least 3 months because that is the full regeneration of sperm. We have people waiting up from 3 to 9 months is usually the general time frame of those lifestyle modifications. But absolutely would recommend a retest to see if you've improved your sperm quality.
Okay, great. Well, Kristen, as we wrap up here, what words of hope do you have for couples who are on this fertility journey and are feeling like there's not a lot of hope for them and they're coming up against a bunch of brick walls? What words do you have for them?
That is a great question. The industry as a whole is really primed to bring new technologies into the space to help with this process. Combination of new technologies to support in diagnosis early on, like what we're doing, but also there's amazing programs out there that pair couples with coaches to help navigate the whole journey. And the bringing in mental health into that is really important. And I think that's being recognized more and more. And I'm sure you're seeing that in what you're doing. It is a very hard journey and you're not alone. And you need to be aware that there are resources out there to help guide the journey within clinic or independent of your clinic and really support your mental health, guide the process, understand the financial impacts. And then there's new technologies coming that hopefully will guide journey to be a little bit more seamless in something that's very difficult and inherently very difficult. So I think I would reach out to those resources that are available right now in guiding, and then know that there are a lot of people trying to make the process a lot better because it is hard and you're not alone. And I think we're all there to make it a little bit easier.
Yeah. And the work that you're doing is an incredible part of that because we haven't had this kind of innovation in male testing. And so thank you for the hard work that you're doing with your team and spreading the word to get these tests out there to help these couples to have the families of their dreams. So thank you.
Thank you so much for giving me an opportunity opportunity to talk about it and for everything you're doing for these patients and facilitating their journey as well. So really appreciate this opportunity.
Yes. Oh, thank you for being here, Kristen.
Absolutely. My pleasure.
Dr. Kristen is so passionate about her work and supporting growing families. Didn't you feel that from her and this company and her test? Truly, from my perspective as a doctor helping families, this is filling a very big need. And so if you're in that place where you've had failed IUI cycles or you've been trying naturally for years and you just haven't had a positive pregnancy test, that's going to be a really good indication that your partner needs this extra testing. And it's an at-home test, right? Super easy to just get the kit sent straight to your house. And the team at Path Fertility were so lovely to offer that discount code for you as the listener here. And so when you're ready to set up that test, go ahead, contact me by signing up for a free PCOS fertility breakthrough session. We'll talk about what testing has been done so far and how this sperm QT test can fit into looking at what's keeping you and your partner from getting pregnant, and then getting a plan to address those things so you can have the best chance at getting pregnant with PCOS. And as we wrap up here today, I want to remind you that this podcast is for informational purposes only. And the only way to get medical advice from me is to sign up for one of those PCOS fertility breakthrough sessions. And if nobody has told you this yet today, I want to be the one to tell you that I believe in you and I believe in your ability to have the best chance at getting pregnant with PCOS. And I am thrilled to be able to be providing these interviews with experts in the fertility community, just like Dr. Kristen Brogard, to help you see these options, these missing links that are keeping you from understanding what's getting in the way of getting pregnant, and then getting these tests that can help you find that root cause of why you haven't gotten pregnant yet. Thanks for being here. I will see you next Wednesday.